That it is a very difficult, it's a very difficult question you are asking about the future. We have set ourselves up to succeed as a department, meaning whatever comes in front of us, we face it head on, and we collectively try to find the best solution and resolve it. Now that also includes the way we interact with our 100 counties, both with NC-FAST, with our social service, with our departments of public health. We work in a county managed state supervised system. We have spoken publicly before that is perhaps something that we may want to look at very closely. Very few states have that system in the United States. It's a rather complicated system. And we have brought up that in previous meetings, that it may be something we would all collectively like to relook at again.
And follow, just to kind of ask the question, I know we've seen this, counties do their budgets, and we've seen a new match rate come in, and just to kind of get a sense of understanding what the county's investment is in this, will you be able to monitor where they're making the investments in these social services programs to make sure that the additional funds are all going to make sure we expand capacity in these areas? And if counties are taking that money and spending it elsewhere, I think that may be a pretty good indication to us where we need to go in the future and see what's doing. And I just want to see if you may be able to monitor that. You tend to know who's on the ground pretty quickly.
To answer your question, we can monitor it, but we won't know exactly dollar for dollar. What we look at is they report to us each month their expenditures in terms of staffing, and we report those to the federal government in order to get that federal match. We can sort of see the number of FTEs by program each and every month to know whether they're staffing up or staffing down.
Final question, Senator Pate.
Thank you, Mr. Chair. Today, I think we've heard a lot of positive things from the department, much more so than we have in the past, and I see people are smiling a little bit too, which has been absent for quite a while, and I commend all of you for the work you've been doing, especially the secretary. In fact, I make a motion that we double the secretary's annual salary.
You can see the headlines now. All right, at this time, if there are no further questions, we'll move on to the next presentation, which I suspect at the late hour will be hopefully be a brief presentation from the Deputy Secretary of the Department of Administration, Mr. Flagus.
Thank you, Mr. Chairman, members of the committee. I'm Spiro Flagus, Deputy Secretary with the Department of Administration. To facilitate resolution of the different legal positions associated with the lease approved by the Council of State and signed by the previous governor and the city in December of 2012, the state and Senate agreed to postpone certain obligations set forth in the lease, conduct an environmental assessment of the Dix property, and make a good faith effort to agree on the fair market value of the property for the purpose of aiding negotiations. This standstill agreement was signed by both the state and the city in July of 2013. Although the agreement has expired and is no longer in effect, the state and city have continued with negotiations in good faith, even in the absence of the agreement. This past year, as negotiations have progressed, the department has studied numerous options and concepts for the relocation and consolidation of DHHS in conjunction with the possible sale of the Dix property to the city. Options studied for relocation and consolidation included both on the Dix campus and on other state-owned property in Wake County. However, until there's resolution regarding the ownership and use of the Dix property, a firm plan and direction for the future relocation, DHHS simply cannot be charted. Added to the unknowns is the future organization of DHHS that was under consideration by the last session of the General Assembly and is currently being studied by a subcommittee of the Program Evaluation Division. Relocating and consolidating DHHS in one location for efficiency of operation is a long-stated goal. It will be a complicated and expensive undertaking. Also, the timing of the availability of funds to begin the consolidation effort will be critical in meeting any timelines and schedules established. In summary, a resolution will have to be made regarding the disposition of the property and the look and organization of DHHS before specifics can be developed regarding the future relocation of DHHS. Mr. Chairman, that concludes my comments, and I would like to note that I may be limited in my ability to respond to questions, given that discussions and negotiations between the state and the city are still active and underway.
Thank you, Mr. Fleggis, and thank you for the best presentation of the day. And I certainly understand your need to be limited in your comments. Do we have any questions this time? Representative Dollar?
Well, I won't phrase this in terms of a question, but just maybe as an overall statement. Certainly a legislator here in Wake County, I think we're eagerly anticipating an agreement that's both fair to the state for the value of the property, and also I think it's still under, if I'm understanding it correctly from the reports, that an appropriate portion of that property would be retained for the future use of the state for offices, presumably for some consolidation of Health and Human Services, which, irrespective of the Dix property, obviously needs to happen at some point in time, because I think everybody recognizes it's they don't operate, that department is not really allowed to operate under any kind of optimal setting over the last, for a number of years, because it's split up in so many different ways. I guess this is just a comment to say that we're hopeful that the end of all this can maybe actually serve a range of needs and put us in a good position to get where we need to be long term. And of course, we hear your comment in terms of the cost of that in the future, and that's something that future General Assemblies are going to have to figure out some capital cost for some projects in state government, not just in Health and Human Services, that we're going to have to figure out a way to pay for.
Representative Murray?
2 quick questions. Have you received a response from the City of Raleigh based on the most recent offer made by the Department of Administration to the City of Raleigh during this current negotiation process?
Representative Murray, negotiations and discussions are still ongoing.
The second question, how is any of these discussions impact continuing campus at NC State?
That's all still up in the air.
Any additional questions? If not, I think appreciate you for the presentation. I think Representative Dollar's points are well made, and it is important, as I think the Secretary has stated in the past as well, the need for her to have her team close by, and certainly when you're looking at almost 2,000 of her employees or staff that are here in Wake County being located in leased property spread out across the county, another 670 so spread out in other state government buildings away from Dix campus, there's certainly a real need to have this discussion and try to find a way to make sure that the department is close by and able to run and communicate as best as possible. So thank you for the presentation. We look forward to hearing more information. At this time, the final item on the agenda for us is the chairs have, if you'll look at the final item in your packet, there should be two documents there. The first is the creation of two subcommittees that the chairs have decided to create this time, which will be over the rest of the interim, or over the next 2 months, studying two separate issues within the two subcommittees. The first will be the medical examiner subcommittee. We've certainly all seen the need there. The secretary has discussed this quite a bit, and we've seen reports, some concerning, and I know she's worked very hard to try to address those issues. And this subcommittee, I think, will be working with the department to try to do what we can here on this side at the legislative building to help address those needs as we return in the long session. And then we'll have a subcommittee that will be looking at Medicaid reform and DMA reorganization. And that subcommittee will examine those two issues and also report back. The first meeting of the Medicaid reform and the reorg subcommittee will be later this month. I believe it is the 24th. The notice will be going out about that soon for the members, and we'll be sending you the additional dates. And I think that the 29th will be the first day of the meeting for the medical examiner committee. And the third committee, which you'll see on the last page you have there, is the traumatic brain injury subcommittee that I know Senator Pay, I believe, was very involved in setting that up, and it will report back as was required in the budget bill to establish a subcommittee. So there's your committee membership for those three subcommittees. They'll be working and reporting back to the full oversight committee in November. And unless there are any questions about the subcommittees, we stand adjourned. Thank you.